So we definitely spent a lot more money on PPE. We have more PPE, and like the prices of gloves, masks, everything has gone up exponentially compared to pre-COVID. So
Yeah.
there's a lot of expenses there, but I don't think like the face shield and the gowns or the scrubs are going anywhere. I think people are going to still continue to wear those. Like I noticed once I started wearing the face shield, how much like aerosols and like crap comes onto your face shield, and it's like disgusting. So I think even
Be
after
good, right?
I'm gonna still wear that face shield because I realize like all of this stuff has been like coming onto my face
Before,
and everything.
before you're like, oh, what is that?
Yeah, exactly. They're like just wipe it away and keep doing like the drilling and all of that. But now it's like, oh my god.
Um, yeah, no, I agree. I don't think so. Check this. It's so per glove, used to cost one glove used to cost 5 cents. Now, one glove will cost 20 cents.
Yeah.
So the exploitation of PPE is sad, and I feel upset about that. But as a dentist and as a dental hygienist, because I'm big on preventative, Pavi was a dental hygienist before, so you have now officially one of the most dangerous jobs in the world. Not to deter you, but you have somebody's head in your like right in front of your crotch, and you have aerosol spraying everywhere. So if you are not breaching physical social distancing, you are definitely breaching it in the dental office. And I think, part of the reason why, one, you have a lot of the baby boomer dentists who are leaving who definitely want to sell their practice, but a lot of upset with dentists in general as to how they were treated with the first wave. Um, I don't I mean, I can't hate because nobody really understood what it was that we were dealing with. But I don't think the PPE is going to go away. I think with the reality right now as it stands and the vaccine not kicking up, is that the patient base, like 30%, maybe 40% of the patients, we're just not going to see for a while because they're going to be scared. Fair enough. So that's on our job to do the marketing to get new patients in here because there are going to be people that need the work. And there's people that get upset that, the question is, how does COVID affect and why are we even open? And I see a lot of stuff on the news, like, why are dentists and dental hygienists working? It's like, bro, if you had a sensitivity before COVID, after COVID, when we opened up, that was a root canal. If you needed a root canal before COVID, you need an extraction now. These things, cavities and gum disease, they march on. They don't care about COVID. They're going to be here before, after, during, it doesn't matter. And things will get worse. And that's why we will never be closed again. We will take a hit, and a lot of our patients will take a hit economically because obviously a lot of people are losing their jobs. So they might not have insurance or they might not have the money or finances to be able to pay for the treatment. But it is our job as healthcare professionals to be able to provide that treatment in a way that they can pay for it because they want it, so we should be able to give it to them in a way that they can afford it. And in terms of, I think, yes, we were talking about like banks want to lend you money, but just right now in this climate with having a second wave, potentially a third wave without having the vaccine at full capacity, I think banks are maybe a little bit hesitant to lend for startup practices. They may be okay with lending money if you want to buy a practice because they have something that's physically there, the investment is not high, and everything is already in place. I think if you were to come out of dentistry right now, potentially purchasing a practice that was already built and is already established might be your better bet than starting up right now, just right now. But I think dentistry as a whole will be okay. But, and it's not to scare anybody, like it is what it is.